Alright, again, new week, new action movie. I'm gonna start doing this every time. So what's up, guys? It's another Hollywood actor, George Clooney or someone. You know, last week was George Clooney. Let me be someone else this week. Let me be Jason Statham. He's too British. I don't know. I know lots of Hollywood actors. I just don't know the real names in person. Just someone, you know, I'm gonna be Abdullah Dawood, the famous Hollywood actor. Anyway, moving on. Hollywood is one thing. Medical school is something else. Hollywood is hard. Medical school is painful then. But yeah, God. So freshest flu is back. Flu is going back. You know, COVID's still here, but flu is going around. Everyone suddenly had, it was 2 weeks ago, it was 1 week ago or something like that, where everyone just had an outburst of flu. And yeah, well, it looks like the flu is back to its full level as before. And let me just tell you, man, it's just been hurting me. But flu is one thing, medical school is another thing. And as you probably guessed by the title of this video is medical school is just, it's not really good for your health. Yeah, it will completely destroy your mental and physical health, which is exactly as it should. It's a stressful career where you're taking care of patients' lives, and patients, you know, human bodies are quite fragile. Because they're quite fragile, it's because they're quite complex. You know, if you're wondering, maybe in engineering terms, the human body is, I don't know, a Maybach or an S-Class Mercedes. Very expensive and very hard to maintain. It's not something like a flipping Toyota where you can just send it, I don't know, drive it for 200,000 miles without doing an oil change. It will be fine. Human body is quite fragile. So obviously, learning medicine is quite stressful and it's quite taxing, it's quite tiresome. I want to tell you, so I've had an exam, my first progress test for stage 3, so year 4 and 5, and it was quite stressful. The lead up to it, I was doing a lot of work, a lot of studying, a lot of revising, so you know, it was quite bad. And to the lead up of it, all that studying and everything, it gave me a lot of headaches, gave me quite a few migraines. And because of that, you know, your body just doesn't handle stress really well. Headaches are one thing, but studying for medicine can also lead to deterioration of both your mental and physical health. And this is where the key part of this video is about. Mental and physical health in medicine is going to go down. It's just a known fact. Here's why. You know, you're in a stressful environment because your body can't handle stress. You know, you're going to be constantly thinking about stress and anxiety and fear, and a lot of people feel like they're being overwhelmed by medicine. A lot of people become depressed, or they may even need psychiatric help. It's quite a common feature in medical professions, all the way from student to doctor and so on and so forth. And not just doctors, you know, healthcare professionals of any kind suffer the same problem. So obviously, you having to make sure that you're doing your best and making sure that you're getting the best grades and making sure that you are acting in the best way you can to take care of patients is going to put a lot of weight on your shoulders. Because of that, you're going to be focusing a lot on making sure that you're doing the best you can to work effectively inside the hospital. And whether that be studying or whether that be making sure that you write up a lot of emails and covering all your bases outside of studying, it means you're going to focus a lot on your work. And here is where your physical health starts to deteriorate. Not only is your physical health going to deteriorate because you're just focusing a lot of work, so a lot of people don't even find out that they have time to work out like they used to before. So it's quite interesting. So healthcare professionals, for example, they work 12-hour shifts. In my opinion, that's quite painful. I did a few healthcare professional shifts back in COVID-19 when it was really bad. It was tiresome, to say the least. And if someone who, like me, has a regular routine of working out and a regular routine of how I should maintain my body, my physical health, medical work will destroy that routine. And that's the thing, because in medicine, you know, the hours are long and the work is stressful and you also have to study outside of work, but also the days are uncertain. Yes, you may have a contract that tells you to work from 9 to 5, but realistically, a lot of doctors and a lot of professionals find that they work more than that because they still need to take care of a patient. The patient isn't just like a commodity, the patient is a living thing. So obviously your routine, and human beings are creatures of routine, therefore your routine will be broken. You're going to struggle, obviously, making sure that your body keeps up with the broken routine. So a lot of people find it hard to work out and take care of the physical health. And on top of that, here's my experience from the exam. Exam stress ruins you. It becomes so much stress in your body. Not only are you focusing on working and not taking care of your body and exercising, you also, for some reason, find it harder. Your body just finds it harder to take care of itself. I'm pretty sure there's a lot of papers out there, and I'm pretty sure I know a few reasons why, but I don't want to say in this video in case I'm wrong. But you just find, like, overworking just makes you more susceptible to stuff like illnesses. So this brings me on to back to the flu that I had, the freshest flu. This flu is actually being really bad for some reason this year. And why? I got at the same time as I was studying for my progress test. So my body was trying to focus on the exams, and also because of the stress and anxiety, you'll find that human body just can't deal with illnesses as well. Now, what's the purpose of me telling you that medicine will ruin your health, mental, physical, yada yada yada. It's sort of both a way of letting people who want to do medicine get a good idea of the negative and the more, not negative really, the more taxing aspects of medicine and what to expect. You know, you should expect the medicine's gonna be hard. It's gonna push you, not just in how you work and how much knowledge you have and how your brain functions, it's gonna push your health to the limit. Not just in medical school, but past medical school. But also, it's just to let other people know who are struggling in medicine and struggling in maintaining their mental health and physical health. You're not alone. We're all on the same boat. And because of that, you know, this week I still have a headache. The exam was like, what, 4 days ago? I can't remember now. Yeah, 4 days ago. And my brain still hurts from it. Even though it was like a few days ago. I still have a headache from it. I never really get migraines. I'm not even sure if this is what migraines feel like. I've never really had migraines. But we're all on the same boat. And yeah. So me, just personally, I've lost track of what I was saying. See, this is how much this exam has affected me. I've lost track of what I was even going to say. And so this is why I'm only releasing one YouTube video this week, because I need time to sort of just chill back and relax and just get enough sleep. So I'll be back to regular scheduling the following week. But in the meantime, reflect on your situation. If you're finding medical school hard, it's okay. We're all in the same boat. If you're going to start medical school, here's a warning for you for one thing. But don't worry, I've made other videos of why it's awesome. So take care of your health. And I'll see you all not in the gym, because I don't go gym anymore. I work out at home. Adios, people.